Hi, welcome back to my channel What Science Says. In these days, there is rapid growth in COVID-19 cases in India, so we should play in a safe side. In this video, let's know some facts about this virus. That how does coronavirus attack your body? What are the actual symptoms of COVID-19 and how does coronavirus move through your body? Let's begin. First, we know there are many types of coronaviruses. Some give you the common cold. The new coronavirus behind 2019 and 20 pandemic caused an illness called COVID-19. First question, how does coronavirus attack your body? A virus infects your body by entering healthy cells. There, the invader makes copies of itself and multiplies throughout your body. The new coronavirus latches its spiky surface proteins to receptors on healthy cells, especially those in your lungs. Especially, the viral proteins burst into cells through ACE2 receptors once inside. The coronavirus hijacks healthy cells and takes command. Eventually, it kills some of the healthy cells. Second one, how does coronavirus move through your body? COVID-19, the illness caused by the coronavirus starts with the droplets from an infected person's cough, sneeze or breathe. They could be in the air or on a surface that you touch before touching your eyes, nose or mouth. That gives the virus a passage to the mucous membranes in your throat. The virus moves down to your respiratory tract. That's the airway that includes your mouth, nose, throat, and lungs. Your lower airways have more ACE2 receptors than the rest of your respiratory tract. So, COVID-19 is more likely to go deeper than other viruses. Your lungs might become inflamed, making it tough for you to breathe. This can lead to pneumonia. For most people, the symptoms end with cough and a fever. More than 8 in 10 cases are mild. But for some, the infection gets more severe about 5 to 8 days after symptoms begin. They have shortness of breath. Acute respiratory distress syndrome begins a few days later. Acute respiratory distress syndrome can cause rapid breathing, a fast heart rate, dizziness, and sweating. It damages the tissues and blood vessels in your alveoli, causing debris to collect inside them. This makes it harder or impossible for you to breathe. Many people who get ARDS need help breathing from a machine called ventilator. As the fluid collects in your lungs, they carry less oxygen to your blood. That means your blood may not supply your organs with enough oxygen to survive. This can cause your kidneys, lungs, and liver to shut down and stop working. The special note for that, not everyone who has COVID-19 has these serious complications and not everyone needs medical care. But if your symptoms include trouble breathing, get help right away. The last one, what are the actual symptoms of COVID-19? According to WHO, symptoms are divided in 3 main types: most common symptoms, less common symptoms, and serious symptoms. In most common symptoms include fever, dry cough, and tiredness. Less common symptoms include aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discoloration of fingers or toes. The serious symptoms, difficulty of breathing or shortness of breath, chest pain or pressures, loss of speech or movement can be observed. Seek immediate medical attention if you have serious symptoms. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Here's what you can do to keep yourself safe. First one, wash hands frequently. Scrub backs of hands between fingers and your undernails for at least 20 seconds with soap and water or alcohol based hand rub to kill the virus. Second one, avoid crowded places. When someone coughs or sneezes, they release small liquid droplets from their nose or mouth that may contain viruses. If you are too close, you can breathe in the droplets, include the COVID-19 virus. Third one, avoid touching eyes, nose and mouth. Hands touch many surfaces and can pick up viruses. One contaminated hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter to your body. Fourth one, practice respiratory hygiene. Droplets spread viruses. By following good respiratory hygiene, you protect the people around you from viruses. Fifth one, wear a mask if you have the respiratory symptoms. Mask isn't required to be worn by all. Only those with respiratory symptoms need to use it to protect others from getting the virus. If you use the mask, make sure it is disposed of properly. This is it for today. If you have any questions, comment down below. If you like the video, press the like button, subscribe me if you're new to the channel and press the bell icon to never miss any updates.